All right, so as we get ready for the last video in Chapter 1, I wanted to pick back up with some questions on the content we have just covered. These questions are directly from your textbook, and they're the ones that are scattered throughout the chapter as you are looking at the content. Now, I want to remind you about the textbook and my philosophy for the best way to use that. Don't pick up your book and try to read an entire chapter. Watch a video, and you notice I break these videos down into short little content or topical videos because nobody wants to sit and watch an hour and a half worth of videos and try to remember anything. Your brain's not going to stay focused on that. So after you watch one of my videos, or if you're in my face-to-face class, after we lecture on a particular content for a day, then go read that part of your book. You're reinforcing it, but you're also chunking that information into different ways of looking at the same stuff. So if you watch the video on body cavities, just read that section in your book. Now, again, I also want to point out at the end of the chapter, you have a chapter summary, and you also have a set of questions that will help you to be able to assess how well you understand this content. Now, that's all in your textbook, but man, oh man, have you got some really cool tools and study resources in the online content. So I do encourage you, get in there and play around. You'll have the opportunity to do some of this with your SmartBook homework assignments, but I've also added in some practice quizzes, but there's so much more for you to explore and find, and work on the things that help you. Don't worry about the ones that don't. If you go in and there's something you try and it's like, oh, I really didn't learn anything from that, well, maybe give it another try on a different chapter, and then if it doesn't work for you, you know not to worry with that anymore. Go find another tool to play with. The last topic we'll cover in Chapter 1 is homeostasis, but guys, it's one of the most important concepts in the entire human body. Have you ever noticed that your body stays about the same temperature regardless what's going on outside? Whether it's cold or it's hot, your body temperature doesn't fluctuate that much. Pretty cool stuff, huh? Have you ever noticed that if you shine a light in someone's eye, their pupil gets really small? And when it's dark, your pupil enlarges? What about your heart rate? Your heart rate increases when you're exercising. It slows down when you're resting. Your breathing rate increases and decreases based on your activity. What about your blood sugar? Blood sugar goes up after you eat. Blood sugar goes down after you digest that food and get all that sugar into your blood and then get it into body cells so we can use it. So all of this is just to say our body maintains a consistent internal environment regardless what's going on in the external environment or within our body. So that is called homeostasis. Homeo means similar, stasis means standing. So it keeps your body, your internal conditions, in a steady state in response to changes. So homeostasis is a central theme throughout learning the human body. And we'll talk about it, even if we don't name it homeostasis, you'll start picking up that we're talking about it in everything we do with A&P. So in order to understand homeostasis a little better, we need to understand the pieces and parts that go into detecting changes and causing an action to occur to get things back to normal. So I want to pause for a moment and ask you to think about the way the thermostat in your house works. Let's say you have your thermostat set on 70 degrees, and that's where you want the temperature to stay. What happens when it gets too hot in your house? Well, the changing in temperature is a stimulus. Something changed in the environment. It was detected by a receptor, your thermostat. Receptors get information and send it to the control center. Well, the control center determines whether or not you need to turn on the air conditioner or the heater. Well, if it got hot, you want the air conditioner to come on, so the control center sends a message out to the air conditioner, which starts pushing cold air into your house. And what happens? The temperature gets back to normal. You get back to your set point. Well, the air conditioner is the effector. The effector is whatever structure brings back the set point to normal. So let's think about that again. The stimulus is what changed. It's detected by a receptor that sends it to the control center that determines what needs to happen and then activates the effector that causes a change to bring it back to normal. Oh, pretty cool stuff, huh? So how do we do that in the human body? Well, let's look again at these components. So the receptor detects the change. So perhaps the stimulus is a change in temperature. The receptors in your skin detect it. Send that information to the control center, which is going to cause an action to occur with the effectors. Now, the nervous system can cause a really quick response. Okay, so for instance, if your blood pressure is rising, your nervous system can slow down your heart rate. Well, what's that going to do? It's going to push less blood out into your blood vessels and decrease the pressure of the blood pushing on them. Bam, you just changed blood pressure. But that's not going to last long. The endocrine system, on the other hand, that's our long-lasting little mechanism here. So the endocrine system, if we think about blood pressure again, the endocrine system could release a hormone, which is a chemical messenger, and it could tell our kidneys to either filter out more water or keep more water, so we get that water in the blood or out of the blood and change blood pressure. Aren't we just amazing? So remember, the receptor detects the change, the control center interprets it and sends information out to the effector to bring about a change that alters that stimulus by getting things back to our set point. Now, most of the homeostatic conditions in the human body are regulated by something called negative feedback. Now, first things first, guys. Negative feedback does not mean bad feedback. Now, let's say you failed a test and your instructor wrote, "Joe, you didn't do well on this test and I don't think you're ever going to pass this course." Well, that's bad feedback, right? That's negative feedback. That's not what this means. Negative feedback results in an action moving something in the opposite direction of the stimulus. So let's go back to your body gets too hot. Okay? So let's look at this little graph right down here. So we've got the variable on the y-axis across time on the x-axis. So let's say this variable, this black line going across, that's our set point for 98.6 degrees Fahrenheit, or approximately 37 degrees Celsius. So that's our normal body temperature. Well, if that temperature goes up, we've gone away from our homeostasis, away from the set point, right? We got too hot, temperature went up. So what happens? Receptors detect it, send that information to the control center, pretty much the brain, right? And what happens? We start sweating to get rid of heat. So what happens? The temperature goes back down to normal until we get back to homeostasis. So did you see what happened? It started because temperature was too high. The action was to bring the temperature back down lower. So it's the opposite direction of the stimulus. If your blood sugar is too low, then we're going to release blood sugar from where we store it. So the stimulus, blood sugar's low. The effectors, the organs and the tissues and the chemicals, cause an action to raise blood sugar. So remember, negative feedback does not mean bad. It means we use the feedback system, okay, to bring us back to homeostasis. opposite of what the stimulus was. If it's too hot, we need to cool down. If it's too cold, we need to warm up. Okay? That takes some practice, guys, but it's not that difficult when you think about what the words mean. So if we look at this image right here, so the stimulus is body temperature rises above normal because we're outside, it's hot, and dude is chopping wood, he's exercising. So the receptors in our skin detect that change in body temperature. The hypothalamus says, wow, it's too hot. Our body's heated up too much. Hypothalamus is part of the brain. So the hypothalamus compares that input about temperature to the set point, 37 degrees Celsius. Well, what's going to happen? The hypothalamus says, all right, guys, we got to start doing something here. Temperature's too high. We got to bring it back down to normal. So blood vessels in the skin are going to dilate or get bigger. So that allows more blood to flow out to the skin, and the heat can then dissipate through the skin. It's going to cause the sweat glands in the skin to start secreting more sweat. And when that sweat evaporates on our skin, it cools it. And then what happens? The effectors caused a change that was the opposite of the stimulus. It was too hot, so the effectors caused us to sweat, release heat, and bring us back to normal. That's negative feedback. Almost all of our homeostasis is regulated by negative feedback. Now notice I said almost all. That should tell you there's going to be a little something different going on with positive feedback. So positive feedback is much less common in the human body. It happens when a stimulus is reinforced or gets more and more and more rather than going in the opposite direction. Now remember, with negative feedback, you get too hot, so the body cools you down. You get too cold, the body warms you up. Your blood sugar goes down, your body brings it back. Your blood pressure's too high, your body brings it down. That's negative feedback. So remember, the stimulus is one thing, and to fix it, we bring it back in the opposite direction, back to normal. Well, positive feedback says, nah, that's not the way I'm going to do things. That stimulus, we're just going to make it more and more and more and more and more. So there are three major examples of this in the human body. Blood clotting, labor leading to childbirth, and breastfeeding. Now, with positive feedback, the stimulus, again, is reinforced in the same direction, so it gets more or it gets enhanced. The end result is to increase the activity instead of returning us back to homeostasis, okay? So that's positive feedback. So one example of that is when a mother is breastfeeding the baby. So the baby is suckling at the breast, and that's the initial stimulus. It's detected by sensory receptors in the hypothalamus. The hypothalamus then signals another brain structure called the pituitary gland to release a hormone, a chemical messenger called oxytocin. Well, oxytocin is the output that's sent to the effector. The effector are the mammary glands within the breast. So oxytocin stimulates the mammary glands to eject the milk out of the breast. Then the baby feeds and the cycle continues as long as the baby is sucking. Once the baby stops feeding, then the stimulus has stopped and the cycle stops. Now, that's one example. Blood clotting is another. So if you get a cut, let's say we get a paper cut while we're studying. Do you just bleed and bleed and bleed and bleed and bleed? No, we want that bleeding to stop. So in our blood, we have these little cellular fragments floating along called platelets. Well, the job of platelets is to stop bleeding. So when you get that little cut, you've got damaged tissues and your platelets start sticking to those damaged tissues. Well, platelets are sort of spiky and sticky, and then we have all these chemicals going on in there as well, and that causes even more platelets to pile up on the platelets that were there. Well, now we got a bigger pile of platelets. Well, guess what that causes? It causes even more platelets to pile up. And guess what that causes? Even more platelets to pile up. and more platelets and more platelets and more platelets until we've plugged the little open area and bleeding stops. That's positive feedback. Another example of positive feedback is labor. So ladies, if you've ever been pregnant and you've ever delivered a baby and you start having those contractions, well, those contractions occur because of the downward pressure on the muscle of your uterus, okay? That baby's pushing, trying to get out. Well, your uterus muscle starts to contract. Well, that causes the same part of your brain, we talked about the pituitary gland, to release oxytocin. Well, oxytocin causes the muscle to contract. So the uterus is made up mostly of muscle, so the oxytocin causes the uterus to contract, which squeezes that little container that the baby's in, right? Well, that pushes the baby against the muscle more, which causes more stretch of that muscle. Well, that sends information right back to the brain, which then releases more oxytocin, which causes more contraction, which pushes the baby down and causes more stretch, which causes the brain to release more oxytocin, which causes more muscle contraction, which causes more stretch, which causes, okay, you get the picture, yeah? So positive feedback enhances the stimulus instead of reversing the stimulus. So here's your image to go with the positive feedback of the infant suckling at the breast. And of course, as long as the baby is feeding, the stimulus is still there, and that positive feedback enhances the ejection of the milk so that baby continues to feed. All right, our next slide has a few questions for you to consider, and then we will finish up homeostasis by looking at some disorders that may occur when homeostasis is disrupted. So take just a minute, read over your questions, and see if you can answer them. Again, guys, homeostasis is one of the basic principles of anatomy and physiology. So to summarize homeostasis, all the different physiological processes that maintain the body, that's homeostasis, but they're dynamic, they're constantly changing. The control center that causes an action to occur is usually going to be the nervous system if we need a quick fix, or the endocrine system for a longer lasting fix. The stimulus is detected by the receptor. It sends information to the control center, which activates the effector. It's regulated by negative feedback, remember, so whatever the stimulus was, the control center activates an effector to bring it back to normal set point. Now, when our body systems fail to be able to maintain homeostasis, well, that's when we start developing disorders and diseases. So what are these normal ranges? What is clinically acceptable as the normal range? So a normal range for a variable is determined by the value for about 95% of the individuals sampled to figure out what their value is. So let's say we sampled 100 people, and for 95 of those 100 people, their body temperature averaged 98.6 degrees Fahrenheit. Well, that sets our normal range for body temperature. But the thing is, you have to keep in mind, the other 5% are still healthy, but their values are not 98.6 or within the normal, quote unquote, normal range, right? I mean, me, for instance, my normal body temperature is like 97.2, okay? I stay cold all the time, but that's my normal. So even though we have normal values, as you see here for temperature, blood pressure, blood sugar, healthy people can be outside of normal. Diabetes is a very common disorder that is the result of disruption of homeostasis. It occurs when our mechanisms for regulating blood sugar are not functioning properly. So, for instance, normally when your blood sugar is high, your pancreas is going to release a hormone that causes us to take that sugar from our blood and put it into body cells so we can use it. Well, what if your pancreas is not producing insulin, which is that hormone. Then our blood sugar stays high and diabetic conditions develop. Now, there are many examples of this in the human body, but when we're treating patients and finding a diagnosis, that tells us the specific cause of the homeostatic imbalances, and we can prescribe medications that may be able to help us maintain that balance, but very often the medications may have side effects as well as benefits. So when a patient has a homeostatic imbalance resulting in a disease or disorder, and we have a diagnosis for this, so your patient is diagnosed with depression. Well, one of the causes of depression is that some individuals have lower levels of a neurotransmitter called serotonin. So serotonin helps to prevent depression. It helps to keep us activated. I sort of call it our happy neurotransmitter sometimes, especially when we're first learning about this. So think about it. If you don't have enough serotonin, depression may develop. Okay? So there are drugs called selective serotonin reuptake inhibitors that can be prescribed to help with these conditions, to help elevate the mood of the patient suffering from the depression. Now, the way that these work is serotonin is released by nerve cells in the brain into this space between two cells. Now, when the serotonin is in that space, it can act on the other cells and, of course, have its action of helping to elevate mood. Now, normally after serotonin is used, it gets taken back up into the cell that put it out to begin with. So the neuron releases it, it acts on the other cells, and happy. But then when it's done, we take the serotonin back up. It's called reuptake, back up into the cell that secreted it. Well, now it's no longer in that space and it's no longer causing happy. So drugs called SSRIs, remember, selective serotonin reuptake inhibitor, that inhibits the serotonin from going back into the cell that secreted it, so it keeps acting on the other cells. Guys, I'm sorry if y'all are hearing a lot of background noise. It just came up a thunderstorm, and it is raining like crazy right outside my door, and I'm sitting close to the door. So, thank goodness we're almost done, right? Now, that's what serotonin does. That's good, right? It helps. But healthcare providers also need to understand how the drugs may affect in other ways, because not all drugs just help. Those are what we call side effects. So virtually all medications have some benefit and some side effects. Many of these side effects can be explained by looking at how they affect the homeostatic control mechanisms that they're acting with. And this can give us an understanding of the mechanisms so that we can prescribe the right medication to treat the right symptoms. And then I have one last slide, guys, and I just left this up here because not necessarily that I want you to understand the differences in all these types of medical imaging, but these pictures show you some of the things that we've talked about with planes and sections. So I want you to get comfortable looking at images like that and be able to tell me what type of plane or section you are looking at. Now again, if you're in my class, I'm not testing you on a patient comes in with a broken arm. Would we do a CT scan or an X-ray? Okay, you'll figure all that out later. Right now, just look at the pretty pictures.